And so I do want you to be open-minded about the fact that labor takes sometimes some twists and some turns that maybe we didn't expect. So in the event that maybe some of these interventions, you came right out the gate, you said, I don't want Pitocin, I don't want the epidural. In the event that those things are brought up, have you thought about how you will approach making those decisions as to whether you're going to go with what's being offered or not?
I like to use the brain technique.
Yes! Did I teach you that?
Yes.
So brain, what is that, right? For anything that's offered, we want to ask, what are the benefits? What are the benefits of this thing that you're offering to me, right? Because again, if the benefit is not something that you feel is beneficial to you, we don't want to explore it, right? We also want to ask about what are the risks? What are the risks associated with that? Unfortunately, I found that a lot of times, if you don't ask what are the risks, they're not always volunteered to you. So it's good to ask. All right, and our A stands for? Alternatives. Alternatives. Yes. What are the alternatives to this thing that you're offering me? Because it may end up that there's an alternative you didn't know about that's maybe less intrusive or less invasive or has fewer side effects. So always ask what are the alternatives, right? And then our I in brain is for instinct. What does your gut tell you?
Right.
Because that's important too, right? Everything is not just about, you know, the data and the studies and the percentages. Your gut tells you something, right? Your instinct tells you something, and we should listen to it and include it in this conversation. And then N is, what if I do nothing at all? What happens? What could potentially happen if I do nothing at all? And once we've asked those questions and we've gotten all that information, of course, I can work with you to kind of digest how you're feeling about things, but ultimately, it's on you to make what you feel is the best decision, and I will support you 100%. Now that I know we are making an informed decision.
Awesome.